Amazing. So after having helped, literally, tens or thousands and thousands of people and patients, can you remember some specific instances where you really helped some of your patients overcome some extreme or maybe some very serious health challenges?
Yeah, there was one patient in particular, and this was early on in my career. I think I was probably 2 to 3 years out of school at that stage of the game, and this is when I was in Fort Lauderdale. But a lady presented to my practice, and she literally had asthma, severe asthma, so much to the extent that when she came in for her very first appointment after she completed her intake forms, I remember it took her quite a time to get from the front hospitality area back to the back of the office, which is where my office was at that practice, and had labored breathing. And she had been referred to me by another member of our office who initially didn't come to us for asthma, but had asthma as a secondary problem. And as we treated her, her asthma improved. So she referred in her friend, so she thought maybe by chance we could help her. So I evaluated her, we took x-rays of her, and we took a good thorough history of her, and so we began treatment. Now, probably within the first 2 weeks, to be honest with you, I didn't really know if our treatment was helping her or hurting her, because her asthma got worse. She'd be on the table, she'd have a garbage can neck, she'd be coughing up all this stuff, her breathing was really bad. And so, not having that experience, as we just spoke about at that time, a very inexperienced chiropractor or somebody else may have quit and said, wow, this is getting worse. But we persisted because I just had a sense that things were really going to work out for her. And so over the next 2 weeks, things kind of stabilized. And then next thing you know, you can kind of see those little things physicians should look for. She's walking a little bit easier. She's getting up from the table. I can hear her voice is starting to change literally a little bit. You don't hear that wheezing going on with her. And I saw those little changes, but I still continue to treat. Well, probably about 6 to 8 weeks into our care, I walk into the office and she's sitting on my table and she's crying. So your initial thought when somebody's crying is something's wrong. I said, oh my God, is everything okay? And, did you have an asthma attack or is something else wrong? And she said, no, I didn't want to tell you, but over the last week, I haven't used my inhaler. I haven't taken any of the medications that I had that helped me kind of cough up all the stuff that developed in my lungs on a regular basis. And I just wanted to see if it was true or not, because I was doing so much better. And most importantly, my friend called me this morning to speak to me on the phone, and I haven't talked to her in a long time. And she asked for me on the phone. She didn't recognize my voice. And when I said it was me, she said, oh my God, you sound like you used to when we were going to school together, because she didn't develop asthma till later on, after she got out of school as a young adult. So, wow, those are super cool. Super cool stories, because at the end of the day, that's why we do our job, is to really make differences in people's lives like that.